America is facing an addiction and mental health crisis. As we emerge from the COVID-19 pandemic, more than ever, research is needed to continue to evolve treatment for substance use disorders and provide objective standards and outcomes. Here today to discuss the importance of research and innovation in the sector is Dr. Olapeju Simoyan, Medical Director of Research for Caron Treatment Centers. Dr. Simoyan, thank you for being here today.
Thank you for having me, Melanie.
And I want to start by asking you about the new research center. Why is this so important right now?
Well, it's important because we understand that addiction is a disease of the brain. So it's important for us to understand the biological mechanisms that are involved because that's going to inform the treatment that we give to our patients. And, ultimately we're focused on helping our patients to ultimately get well and stay in recovery and live better lives. But we really need to understand what's going on biologically with them and come up with effective treatments.
And what areas of research is Caron pursuing, and how will that help patients?
So we have a number of research projects going on. Broadly speaking, we're looking at repurposing medications that have been approved for other uses to see if they'll work in our patient population. We're also looking at predicting risk of developing opioid use disorders, and we're also looking at the risk of relapse after treatment.
How will this new research center improve outcomes in treating substance use disorders?
So, like with any other disease, treatment works best when it's individualized to the patient. So we are hoping that with more treatment options available to patients, we'll be increasing their chances of recovery and their chances of ultimately having sustained recovery and having a better quality of life.
And when you're doing this research, why is collaboration so important in research?
Oh, nobody ever does research alone, at least not successfully. It's so important to bring together resources, to bring together people with different perspectives. And we have collaborators in various institutions, including Penn State Hershey Medical Center. We've collaborated with Stanford University in the past. We have an advisory council with members from different organizations, including Johns Hopkins and Harvard. So we have a lot of collaborators, and we continue to establish more and more relationships because it's so important to work together as we work to fight this epidemic of addiction.
And you'll also be doing training at the new research center. So what kind of training are you going to be doing?
All right, so training is an important part of what I do. I'm an academic physician myself, and I'm involved in training our research fellows. They come for a year of training, clinical training in addiction medicine, but they also get research training while they're there. They're required to conduct scholarly projects. So I'm very involved in training our fellows in research, but we also, for the future, hope to have training programs where other physicians and other healthcare professionals can come to us for research training. We also have a pipeline program where we'll be training high school and college kids who are interested in the health professions and introducing them to the healthcare professions in general, but also introducing them to research. So we have a lot of exciting programs that we're planning.
That's great. Dr. Simoyan, thank you so much for being here today and teaching us more about this new research center.
Oh, my pleasure. Thanks for having me, Melanie.
And if you'd like more information, you can visit caron.org.